I was taking 3 Advil 2 to 3 times a day. I wound up with a GI bleed. They made me sign a form in the ER that the next time I passed out and bled, that they were going to have to give me a transfusion. So that's how bad the pain had gotten. It's not easy when you're dealing with chronic pain because it becomes who you are all the time. I've been dealing with chronic pain, God, it's got to be about 10 years now. Been doing a lot of crazy stuff to my body. Jiu-jitsu, Muay Thai, rugby when I was younger, football, and always had some sort of back pain. I got a glute pain one day out of nowhere. By July, the pain was shooting down my leg, and I'd done PT, seen every doctor, physical therapy, chiropractic, pain management. I was on 600 milligrams of gabapentin 3 times a day. Pain was just so intense that I actually opted for surgery in October of 23. I was unable to lay down. I was unable to sit. The only relief I was getting was standing. Actually wound up sleeping in my car because the only comfortability I can get was with a pillow rolled up behind my back, which then caused my ankles to swell, which could have been a deep vein thrombosis, which could have been very dangerous. So I was advised against that. So my only option, I believed at that point, was to get a laminectomy, a microdiscectomy, and a spinal decompression. Surgery was at 10 o'clock in the morning. Woke up at 1 and was out of pain. I was insanely optimistic. Sure enough, about 6 months later, I tweaked my knee a little bit in jiu-jitsu, and there was some glute pain that came back. My daughter's only 10, and not being there and able to do the things with her, she still wants to roller skate, and she still wants dad to go down the water slides with her. Meanwhile, I was worried about going to pick her up for school because, you know, what if my back locked up and I couldn't drive or something happened in the car? There were times that I wouldn't go places with my daughter or my wife. I stopped doing jiu-jitsu, I stopped doing Peloton, I stopped doing yoga. Anything that I was doing to keep myself physically fit and mentally fit, it basically had to stop. I couldn't play video games because I couldn't sit on the couch anymore. I couldn't lay down on my back. I could not get into a position where the pain wasn't so intense that I could actually fall asleep. What I was trying to do was medicate myself. Doctor prescribed some opioids. Even that, the pain would just kind of push right through that. I was still trying to maintain a full-time job, still trying to be present for my family, and getting 1 to 2 hours of sleep at night. My fuse was super short. You know, I was constantly angry, constantly losing my temper, definitely not my best self at home or work. And then I found Dr. Chris. I found Barefoot Rehab. And I remember watching a video of him, you know, talking about the nerve getting stuck. And when he said nerve getting stuck, that just resonated with me because as I just constantly felt that the nerve was trapped somewhere. And that's when I called and said, you know, let me find out about this. When I put down what my ultimate goal was to do jiu-jitsu again. And he was very honest with me and said, "Oh man, I'm not sure. You know, like we'll get you. We're gonna do our best to get you out of pain, but like, you know, we just don't know right now." While that hurt and didn't give me the answer that I wanted, I think it's what I needed to hear, and it kind of levels at me. And then I said, okay, you know, this guy, he's being like realistic with me. He's not telling me what I want to hear to get me, you know, to commit. And that's the difference that I found with all these other guys who were trying to sell me these crazy packages. He gives me this big hug and I'm like, oh man, like what are we doing here? And then you're just like, man, this guy cares, right? Like he just wants you to be out of pain. He's, you know, he listens. And that was another big thing. He hits that spot and my first thing was like, oh God, I hope that's not it because it's gonna hurt. And it's 90% of the time that's where it is. And that pain it's there. It doesn't feel good in the moment, and I'm usually mad at him the next day. But, you know, 2 days later, I'm like, man, like, we got it. But walking into this door on a scale of 1 to 10, I would say I was at a solid 7 every day, right? And sometimes it would be an 8, 9.
Today, where would you be? Scale of 1 to 10.
1 maybe. I now have tightness and not pain, which is insane because I feel like I lived with tightness for so long that now that I'm back there, it's, you know, I'm almost getting greedy. Like I want that gone now too. It's a good place to be, man. I'll take it. I'm back to Peloton. I'm back to yoga. My daughter wanted to go roller skating, and I was like, I can go. I'll watch you roller skate. You know what? I was like, I'm going to give this a shot. And I did. I roller skated. If you would have told me a year ago that I was going to be on roller skates, like I would have told you you were crazy. I hadn't been on roller skates in 30 years. I'm probably about 75% back to everything. The only missing thing is jiu-jitsu, and that's a goal I'm working towards that. If you feel like you're not getting the answers, I've seen all these doctors, I don't feel like anybody is listening. I need someone to listen. Dr. Chris listened. He didn't just give me this cookie cutter approach. So if you've seen the doctors who are giving you the cookie cutters approaches, that's when to see Dr.